right, we're going to talk about foot x-rays now. You can have the patient lay back if you need to, or they can sit up if they're old enough, big enough to do so. You want to make sure that you flex the foot and the knee so that they're essentially kind of stepping on the cassette. And again, you want to make sure it's nice and in the center of the field. Relax your foot, please. Thank you, sir. And I'm going to rotate this. Good. I like to mark right about the toes, just like that. You want to make sure you catch all the calcaneus in the back. Make sure that your marker's not in the soft tissues, okay? And we could probably collimate just a little bit more, just like that. Very simple. Oh, you know what? I forgot something. For the AP, we actually have to angulate the tube to match the metatarsal angles. It's about 15. Good. See, even I forget stuff. All right, so angulate your tube, match the angle of the foot, and that's going to be your AP of the foot. So very simple to go into the oblique. All you have to do is medially rotate the foot about 15 degrees or so, and you can have parent hold the knee just like that. Perfect. So you want to straighten out your tube now. We don't need that angulation anymore. There we go. And again, I like to keep my marker kind of around the toes. There we go. That's going to be your oblique foot. All right, and now we're going to go into a lateral. So we're going to take this foot and we're going to rotate it out, 90-degree flexion. Now you're going to collimate down. You want to make sure you get the joint here, but we don't need much of the tip bib. But we need all the way to the toes. And just be mindful, it's very easy to clip the soft tissue structures. You see how close this sort of shadow is here to the light field. So I know that I'm going to be really close, or if he has any sort of wiggle at the time of the x-ray, I'm probably going to clip the soft tissues. And you're thinking, oh, it's just soft tissues. We're looking at the bones in x-ray. Well, yes, we are, but there's a lot of soft tissue information that we can get. We can see lacerations, we can see air or gas in the tissues, just like for an infection or something like that. So soft tissue structures in x-ray is very valuable, so don't clip it, okay? All right, so you want to make sure, though, too, that when you're doing your lateral foot, that you align. Yeah, perfect. Okay, so I like to do is get a sheet, and I like to feel the arch here, and I like to try and get it in a nice lateral. And by doing that, I like to put a sheet or something just under here so that you can make sure you can try and get this arch in a nice lateral. So of course I wouldn't have my hand here while we take the x-ray. Okay, I need you to hold your foot just like that. Can you do it? Hold your foot just like that. So he's doing a great job. I would take my x-ray just like that. If they can't and they keep dropping the foot, get a positioning sponge or something to give support, whereas your hands wouldn't be in the view, but this sponge or whatever you're using would give them the support to hold that flexion. Okay? And that's a foot x-ray.